Namaste. My name is Dr. Shreya. I'm a yoga teacher and a dentist, and I'm here to introduce to you Dr. Jerry, who's an osteopath, chiropractic, and he's a yoga teacher, and he has a postgraduate training in physiotherapy. So, Dr. Jerry has a 32 years of experience in Australia. Let's welcome him here, Dr. Jerry.
Namaste. It's a delight to present my BAM method, breathe, align and move, which I've utilized over 32 years with literally thousands of patients in Australia. And it's been amazing to incorporate yoga clinically. So my skill is not so much as a yoga teacher, but more as an individual remedial clinical application of yoga to musculoskeletal conditions. And what's musculoskeletal? Neck, back and joint problems. So today is more of an introduction of the different techniques that I've used in my practice to treat very effectively clinical conditions. So I've purposely named the method BAM, let's get BAMmed, breathe, align and move, because I feel that everything starts with the breath. And as yogis we know the importance of prana. And I've found that so many people have what's called suboptimal or dysfunctional breathing. And you can actually do that for many years in your yoga practice and still have suboptimal breathing. So we're going to start with, right now, we're going to ask Shreya to come forward. And the point of this demonstration is not so much to limit it between myself and Shreya, but to pass on this information that you can use and apply in your yoga teacher instructing. And I've had the feedback that some of this needs to be done in a yoga therapy course. So not necessarily. The point of my presentation is to show you how this can be brought into standard yoga classes and complement the practice of yoga literally around the world. So we're going to start off by, we're going to ask Shreya to turn that way. And a little bit of anatomy. Because of my medical background, I want to really make it really clear that there's going to be downloadable diagrams and handouts, videos and diagrams on a lot of what I explain, which will definitely make this a lot clearer. So we're going to start off by checking breathing. And ideally, this is done in front of a full-length mirror. So we're going to ask Shreya to do 3 deep, slow inhalations, exhalations. Now, what am I looking for here? I'm looking for whether the shoulders raise up, 2 things, and whether the lower 6 ribs, the diaphragm, which is the main respiratory muscle, together with the intercostal muscles that raise the ribs up on inhalation and lower the ribs down on exhalation. We want to get a rib cage excursion in the lower ribs going out on inhalation, in on exhalation. And ideally we don't want that. That's the accessory respiratory muscles activating the upper traps and also creating a lot of neck tension. So I'm going to come around, and I need to always get permission. If you're going to touch a patient or literally anyone in public, you always want to get their permission. So I'm going to ask Shreya, is it okay if I gently touch your lower 6 ribs? And we realize that if the lower 6 ribs aren't moving, the diaphragm isn't moving. It's literally the same as if the elbow isn't flexing, that bicep isn't moving. Lower 6 ribs. Okay. Deep breath. Okay, so she's got about 50-50. 50% rib excursion out and in on the inhalation exhalation, but she's still using the upper traps. So what happens is the human body needs a certain amount of oxygen for lung capacity to function. So if this is underactive, the main respiratory muscles, diaphragm and intercostals, then the upper traps move. So we're going to swap places, just reverse. And I'm going to ask you, only if you feel okay, to put your hands on my lower 6 ribs. So it needs to be very light, just so your whole hand just molds around, and that's the 12th rib. It's right there. And you're watching whether, so I'm going to exaggerate. And it's great for yoga teachers to do this at the start of their classes. It literally takes seconds. And we're going to run through a sequence to correct this, to make it optimal breathing. So you'll find, I've found in my clinic, 90% of people breathe like this. That's how Shreya was initially, until I pointed it out. So what we want to do is nothing here, but everything here. So here we go. I'm going to come down to the horse stance. Hold, breathe out. Hold, hold, hold. Deep breath. Hold, hold, hold. Breathe out. So it's an incredibly therapeutic thing. And again, bringing in a uniqueness, even in like level 1 introductory yoga teacher, not training, but teaching yoga, to do a quick analysis with your students. It takes seconds. Okay, so then now how to bring more awareness down into here and less here. So we do it on the ground, the easiest way. So I'm going to ask Shreya if you can move off the mat, please. Maybe out of the frame. And I'm going to bring this here. Okay, back. Now we'll talk about this in the third sequence when we talk about move, but we're really wanting to bring, to me, one of the many positives and purposes of yoga is to bring into present time and to become embodied, because our whole culture with social media has become disembodied. So what I've done is just taken a moment to feel the pads of my feet, the plantar underside aspect of my foot, to feel the lumbar spine flat, and to feel the shoulder blades melting into the yoga mat, and with deep breathing. So we start off, it's called 4-part breathing, and we start off, everyone will get this. The first part is belly breath, dab, deep abdominal breathing. So you put your hands on your belly, on your navel, and as you breathe in, belly goes out. As you breathe out, belly goes in. Now literally everyone will get that. Now that's part 1. Part 2 is where we put one hand, left or right, doesn't matter, on the abdomen, and the other hand on the actual sternum, upper chest. And what we're wanting to do, the 4-part breathing is this. Breathe in, out, out. So here we go. As you breathe in, the belly comes up, the same breath comes up into the sternum, and the sternum lifts. So you want to feel the sternum under the palmar aspect of your hand raising up, and then only this comes down on the out breath with pursed lips. So you can actually audibly hear the out breath. And then lastly, the transverse abdominis draws the abdomen in on the exhalation. Demonstrate one more time. Breathe in, belly comes up, just the sternum in isolation, then just in isolation the sternum goes down. Lastly, abdomen gets drawn in. So why are we doing this? We're starting to get more awareness of moving air in different lower ribs, upper ribs. And also the beauty of the respiration. There's the cardiovascular system, neurological, urogenic, musculoskeletal, neurological, all these different systems in the body. But out of all those systems, there's only one that's under voluntary conscious control. That's respiration. So you can do quick pranayama or very slow, deep inhalation. So you can control the length, the duration of the breath, which we'll be going into shortly in this breathing sequence. Okay, so once you've done that, then you come around and very gently, softly wrapping around the lower 6 ribs. Now that's not that difficult with practice. The more challenging one is to wrap your hands around the lower 6 ribs, and as you breathe in, belly doesn't move, upper sternum doesn't move, only the lower ribs. breathing in. So you're putting a little bit of inward pressure with your hand, so the brain is recognizing it's pushing against something. Okay, so that's the breathing sequence. And then we want to move up into how to then bring that breath, how to bring the breath into the whole lower ribs, mid ribs, upper ribs. And we're going to do a little range of motion test with Shreya, which again you can do very quickly with your yoga students. And this is, to me, very important. With great respect, we're going to point out a very common pattern that Shreya has that pretty much 90% of people have. And I've actually treated a lot of professional yoga teachers in my area, and they all have this particular quality. So what's this quality? So what we're doing here is we're wanting to get what I call isolated thoracic spine extension. So I'm going to demonstrate what that is. So what you do is you come around in like a horse stance, wide foot, hands under your elbows. And what I'm doing, in the chiropractic terminology, it's a P to A translation, posterior to anterior translation. So you're not forcibly, you're just gently doing that movement, monitoring how much that thoracic spine moves forward in what's called, that's extension, that's flexion. And most of our culture is locked in thoracic spine flexion. Why? Computers, smartphones, driving, sitting. That's why. So there, and breathing up, forward, just relax, let it go. Oy, there she goes. And forward again, so that's the flexion. We're seeing how much. Now, we know she's going to have, well, she's got a good wake. I didn't know, because I'm just testing now. She's got really good movement. But the problem is, I don't know if we can zoom in on the camera, but most of the extension is coming from the lumbar spine. That's the common problem. Hands down. So what's happening is she's getting a lovely sternal lift, but it's all coming from the lower back, what's called extending or arching back. And you might think, well, what's the problem with that? Well, the problem with that is these muscles here, called the lumbar spine erector spinae muscles, that do that, they're active. These are underactive. So you can do years of chakrasana, camel, all the back bends, and the problem is this whole area becomes underactive. So what we're wanting to do, yeah, just 1 minute. I've got a spray. Okay, so what we're wanting to do is what I call isolated thoracic spine extension. So what is that? So what we've seen Shreya do is do that movement, which is super common. And as yoga teachers, we have the ability with our students to actually correct that. So how do we correct it? We simply draw the navel in with a little bit of posterior pelvic tilt, and we'll be covering that in the movement sequence. And then you feel the lumbar spine flat. How do you know it's flat? Well, you run the back of your hand up and down the spine and it's flat. If you tilt the pelvis forward, the belly comes out, and you run your hand up and down, it's actually curved, which is actually not healthy. So we want to come back, flat, then you come up and put your thumb on what's called the spinous process of the thoracic vertebra. That's the only bony part you can actually feel. And you want to try and get that movement. Now, the beauty of this, the reason why I like this approach, is it's very definitive, it's very black and white. If that vertebra, thoracic, is going forward, then these muscles here have to be activating. So this is, what I'm doing is giving you that amount of information, and you might say, oh my God, that should be in a yoga therapy course. But if you go away with that, that's great. If I only give you that, you're going to go away with that. So I'm going to give you a whole lot of information. And those who are interested, you can do follow-up with Google searches, ChatGPT, and do the follow-up, or contact me by email, WhatsApp. So what you're doing is you're feeling for that thoracic vertebra going forward, and that's activating definitively 3 key muscles. The rhomboid muscle, which is scapular retraction, that's protraction, retraction. Then bring in the middle fiber of the trapezius, which is again shoulder retraction. And the deeper muscle, because all muscles are 3 levels, superficial, intermediate, and deep. Then you bring in the thoracic erector spinae muscles that allow that whole lovely sternal lift. So those three muscles are activating, and the reason why I'm going into detail like this is the vast majority of people don't have the upper thoracic area moving. So let's demonstrate on Shriya. And I'm doing it in a way that you can do it as teachers on your students. And you might think, oh my God, that's yoga therapy. Nay, nay, nay. It literally, you need a chair. It takes 30 seconds, maybe 60 max. And you're really giving people something of great value here. Yep, hands off. So what I'm going to do here, which is what you do as a teacher, is you put one hand on flat here, and your other finger on the spinous, or your thumb on the spinous process. And you don't want to feel that area of the spine going forward. You want to feel all the movement right just under my thumb. So try and raise your elbows up. In, and down. There's a little bit of movement coming up. Almost nothing, back to, which we'd expect, and back down again. Now do it normally, like you would normally do, like a lovely back bend. And there, that moves. Okay. So hopping up, we'll switch places. I want to actually elaborate this. I'm going to get Shriya to do it on me. So what you do is you put one hand flat on here. She's putting her hand flat on my lumbar spine, and she puts the fingertips right on my spinous process. And I'm going to put my own thumb there so I can really monitor it as well. And what I'm doing is just this. We want to get a nice, feel that, Shriya? Yeah. That really nice movement there. Now the beauty of this, I feel quite passionate about this because as a clinician, as a chiropractor, there are techniques, and we're not certainly disrespecting my profession, but there's a lot of yoga, chiropractic techniques that just do lumbar spine and cervical adjusting. They don't even do the thoracic spine, they just do lumbar and cervical. And the thoracic spine is massive because it's the whole breathing mechanism. So what happens is that we want to actually see the sternum lift in isolation, not lifting from here. And so a little bit of musculoskeletal anatomy on the respiration system. So it's called a cage because there's 12 ribs, 2 floating. They're called floating because they actually don't attach to the sternum, but the other 10 attach to what's called the transverse process of the actual thoracic vertebra and come in and connect into the sternum. So you can't actually have that lovely full functional movement of the full breath if you don't get that thoracic spine extension. You actually physically can't do it. It's just the way the anatomy works. So to actually allow the ribs to come up in inhalation, and what allow the ribs to come up is primarily the intercostal muscles that raise the ribs up on inhalation. The thoracic spine is extending back. Because of the articulation of the rib to the transverse process, you need to have that extension of the thoracic spine. There's the inhalation. And then you have the thoracic spine flexion, and then the ribs go down on the exhalation. So to get that lovely full inhalation exhalation, you need to have mobility in the thoracic spine. Okay, so now we're going to go into another movement. And one of my goals in yoga, just this is one of my own personal goals, is to bring us all into sattva. It is Raja, Tama, Sattva. Sattva is the middle way. And if we can actually use yoga as yoga teachers to allow our students to come more into the here and now, like Eckhart Tolle would say, the power of now, then we're really giving them what I call a holistic gift, holistic body, mind, spirit, emotions, not just what I call yoga gymnastics, which is combining, gymnastics with yoga poses. So one way around that is to slow down the breath. And the breath is very related. Slow, deep inhalation, exhalation is related to the parasympathetics, which is all about conservation. And if you're doing shallow breathing like this, which a lot of people do, fast breathing, upper lobes, that's actually the receptor sites for the sympathetic nervous system, which is the fight or flight, is in the upper lobes. And the receptor sites for parasympathetic is in the lower lobes. So for doing that, we're actually doing all this yoga, wonderful yoga practice, feeding into the whole what I call sympathetic dominant culture, What are we truly offering? I'll leave that up to you. So now I'm going to come down into this particular movement, which I'm going to attach a video on of Mick, a patient of mine who had ADD, depression, anxiety, and he used this primarily technique to get better improvement in those 3 problems that he had than 15 years of medication. So here we go, and I've got a video of a testimonial. Come down on your back, bend knees, lumbar spine flat on the mat. I always like to do this. Bring the chin in to lengthen what's called the neck extensors, because the vast majority of people have tight neck extensors, creating a whole gamut of lightheadedness, migraines, headaches, neck tension. So we want to actually bring the chin to chest. So first off, do a mechanical movement. So it's purely visual. So I'm wanting to get these 2 points touching the mat at the same time. And as they come up, they synchronize. So a lot of people will do this. But we're wanting to actually really, so you've got to really internalize. This is the whole bringing into the here and now. So you've got to really visually get that exact movement. Then you combine it with breath. So what I'm doing here is I breathe in, I breathe in, I breathe in. Now as yogis, hopefully you're aware of the Ajna breath, where you can actually hear it. I can't hear this in clients, students or patients, but you're going to hear it yourself. It's an internal nasal sound. Breathe in, breathe in, breathe in, breathe in. And this arm starts lengthening, stretching out all the intercostal muscles and the latissimus dorsi. And then the important thing is to make sound. Breathe in. Slow, deep inhalation. So your inhalation starts here. Inhale, 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 inhale. End of inhalation. Start of exhalation with the sound. Okay. That's the movement. And so what I'm doing here, I'm bringing in a sound. So what does this do? It's a physiotherapy technique that if we we'll get Shreya to come up just to get her to experience this. So you put your hand on your belly, both hands, and as you breathe in the nose, you're breathing out the mouth. So you're breathing in the nose and then out through the mouth, just an open mouth. One more time. You probably feel there's not a lot of movement happening in your abs. Now this time, and again, a lot of people are self-conscious, but it's a therapeutic move. So as you breathe in, you're doing a hiss through the teeth like a snake, like Shiva's cobra wrapped around his neck. And the louder you can do this, you'll feel the abdomen contracting. So I'll come up and I'll have a listen. Breathe in, nose. Breathe out. See that? So even that breathing actually activates the core muscle, the abdominal muscle. It's really good. Okay, so let's move on. I'm going to do the next one. If you could maybe come off the mat. Okay, so we're going to now demonstrate that same move on Shreya. So what you do it in 2 parts. First is mechanical, not connected with breath. So you bring your arms straight up vertical, both arms up. And all you're doing is, as this arm goes back, this one goes up, this one as this goes back. So it's called equidistant. So you can go like that and stop at any point, and that point there is equidistant to vertical. So we're trying to get those 2 points touching the mat at precisely the same time. Visually, don't worry about the breath at this stage. So you're going back down. See, that's gone too fast. Come back up again. This is the practice. So you got to. So this is the internalization to fully embody yourself. So here we go. Try and do it again. So you're going down, and about this point, this arm starts lengthening. and you're trying to get those two fingers touching at the same time. Back. Yep, there. Then back up again. And you're trying to get, that's going too fast. Bit of a Zen master here. And then coming back up again. Trying to get them to come up precisely matching at the same time. There it is. Done. Okay. So in the next movement is you're bringing in the breath. You know that you can actually internalize that sound, hopefully. So now the start of inhalation, where you go, breathing in, breathing in, breathing in, breathing in. That's going too fast. Breathing in, breathing in. Breathe in, breathe in. So this is what we're doing is slowing down purposely the length, time duration, and depth of the inhalation. Breathing in, start lengthening that arm. Touching at the same time. There, yep. Then the exhalation with the sss. You've got to make the sound because you audibly hear the exhalation. If not, you won't be able to tune into it. That was pretty good, because a lot of people will go sss, or move the arms far too quickly, or reverse it. Okay, great, thank you. Coming up. Okay, so the flow on from that. So what we've done here is we've brought in the sss, we've brought in the slower inhalation, exhalation. So now we're wanting to move that into a yoga pose, which again, I keep stressing this needn't be yoga therapy. You can bring this into like Yoga 101, into a beginner's class, because everyone's going to be shown that. And the classical yoga pose is just that, there it is there. So we're going to do a slight variation of this. So we're going to incorporate this particular posture to stretch the intercostal muscles and to really incorporate that slower, deep inhalation, exhalation, which we've just done in that particular movement. Come down. So the way I like to do this is you have that back foot turned in at 45 degree, that forearm slowly, that stretching that left adductor, and then put your hand on the hip, and you look at that shoulder. So you really want to have the full rotation, because you won't get as much stretch here and side bending if you're down here compared to here. Then we're doing two distinct parts to this. First one is mechanical. So you put your hand on the intercostal ribs gently, and you're pushing that forearm into the thigh, and the whole rib cage comes up and down, just like this. And what you're doing is getting a side bending in the thoracic spine, and you're stretching out all the intercostal muscles. If the intercostal muscles are tight, then you won't get that full raising of the ribs on inhalation and lowering on exhalation. So here we go. That's the first mechanical movement. And then you bring the arm up. So rather than the classical, we're actually going down, and you get like a crescent moon, which is further stretching the intercostals and the key muscle, the quadratus lumborum, that connects the iliac crest to the 12th rib. That gets stretched as well. So here we go. So we breathe in the nose, and I lengthen. I don't use the word stretch. I lengthen on the inhalation. Hold, 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 and I'm contracting the pelvic floor. On the inhalation, I lengthen that little bit more. So I'm making sure that I'm lengthening a little more on each inhalation and not dropping back. If I'm breathing in, breathing out, breathing in, breathing out, there's no length happening. So breathing in, hold, hold, hold. Even when you've finished the full inhalation, you still hold, but you keep lengthening, because what's happening is you've got the expanded lungs inside the rib cage, further accentuating this stretch of the intercostal muscles. Other side. Look left, mechanical move. And you find a lot of people won't be able to do that. So that in itself is a really good exercise. And then we come up, dipping down in the nose, exhaling. Next inhalation, lengthen. You can actually see that whole lengthening happening. Exhale. Last one, breathing in. And the lengthening of the arm. And that's the breathing sequence. End of part 1.